Hello and good afternoon, everyone. My name is Amanda, and I'm the Community Outreach Coordinator here at the Missouri Poison Center. And with me today is Abby, and she is one of our nurses and certified specialists in poison information. Somebody who will answer your call if you ever call the hotline. And so we're going to talk today about some of the new and up and coming weight loss drugs and some of the concerns that we're seeing as poison centers, as well as just talk about safety and prevention and make sure that people stay safe with them. So I will pass it off to Abby to go ahead and get started talking, talking about them in general.
Yeah, so hi, my name's Abby. I'm a nurse at the Poison Center. I've worked here for about almost 6 years now. And I take a lot of calls from the public, and we have had a significant uptick in the number of calls concerning weight loss medication errors. So we wanted to talk about this and clear up some information and hopefully help prevent any future errors. So for the weight loss drugs that we're going to be talking about today, it's specifically the glucagon-like peptide or GLP-1 receptor agonist. This is a new popular medication that's being taken for weight loss. It's designed to mimic the effects of the GLP-1 hormone. So that hormone regulates blood sugar levels, appetite, and digestion, and also increases metabolism and decreases the absorption of food. So these were originally designed as anti-diabetic medications, and during the trials, they found an unexpected but beneficial side effect of significant weight loss. So this has led to off-label use as a weight loss aid. And the medications are typipally still used with lifestyle changes like diet and exercise, of course. And they come by the common names of Wegovy, Saxenda, Zepbound, Ozempic. That's probably the most popular or the most known medication. And they can come in an oral pill form, or they're injectables that are done once weekly. And then some are given only in a healthcare setting, while others are taken at home. And then for these medications, there are three main things to consider. So the first thing is that is FDA approval for non-diabetics. So currently the FDA has not approved Ozempic specifically for obesity, although some healthcare providers do prescribe it off-label for this use sometimes. There is a similar medication called Wegovy. It has the same active ingredient, which is the semaglutide, and that one is FDA approved for weight loss and obesity. The second thing to consider is safety concerns for non-diabetic people. So with any medication, of course, there are side effects and risks to think about. So before prescribing a medication like this, a healthcare professional is going to assess your overall health and make sure the risks are low if they're prescribing this medication to somebody. So a healthcare professional will review current medications that a person is taking as well, assess their overall well-being, and especially look at their kidney function to minimize potential health risks from taking it. And then the third thing to consider is consultation with a healthcare provider. So anyone taking these, whether you're diabetic or not, you should consult a healthcare professional. They can evaluate your overall health, discuss potential risks, and monitor for any adverse reactions during the course of treatment. So of course, it's something that you would not want to take if it's not being prescribed to you, because there are potential risks of doing that. So as far as side effects of these medications go, the most common side effects with therapeutic use are going to be nausea, vomiting, abdominal pain, and diarrhea. And typically with these medications, it's something that you have to start on a very low dose of. Once you take it for a little while, you build up tolerance to the side effects, and then you increase it as needed. So there are some less common side effects that can occur with using this, such as delayed stomach emptying. It's called gastroparesis. And there are more serious effects that can happen, like dehydration, electrolyte imbalances, kidney issues, and pancreatitis. So as far as overdoses go with this medication, one concerning side effect is that it could cause hypoglycemia, where your blood sugar is very low. So side effects in general from this medication are usually mild to moderate, but of course, if you have an overdose or mistakenly take too much, it could cause severe side effects. So some of the more concerning symptoms would be feeling lightheaded or dizzy, feeling shaky or jittery, if you're sweating, having chills. It can cause irritability, headache, weakness, fatigue, nausea and vomiting, of course, confusion, or potentially even passing out or seizures in some rare cases. So for the types of errors, we've had a really wide variety of mistakes that can happen with this type of medication. Overall, we've had a significant increase in the number of calls about errors or mistakes. Our call numbers have increased 1,500% since 2019. And it really has to do with these medications being more frequently prescribed and more readily available. And then they can be somewhat tricky to give, especially if it's a new medication. So as far as the calls that we get, some of the errors, most of the errors happen in adults. The most common age range is for like 40 to 69-year-olds. It tends to be more female patients than males that may be using it. And but we do get calls on all ages and groups of people. So some of the errors we've seen are in cases where someone has been taking it for several months and stopped the medication. And then when they restarted it, they started taking the high dose that they had been previously taking. Again, because it's something that you kind of build up a tolerance to with time, if you don't take it for a period of time and then redose, you can unfortunately experience really terrible side effects. So that can cause a problem. There have also been cases where the medication has changed from twice daily to once daily, and then someone may continue to take it twice daily by mistake. We have had some cases of a medication being dispensed incorrectly, or potentially the prescription was written incorrectly. So in one case, a person had an 8 milligram pen instead of a 2 milligram pen. So you can imagine taking a much higher dose is going to be much more likely to cause that person to have side effects. In other situations, we've had patients mistakenly take a once weekly dose every day, mainly because they didn't realize the dosing instructions were different than they thought. We have had child exposures too. In one case, I know I got this call. It was a child that got into the refrigerator where they were supposed to keep the medication, and they somehow broke the top of the vial off and ended up drinking it. So it is something that should be kept, out of reach of children if possible, or potentially locked up if you have little kids around. And then for the Ozempic pens, sometimes it could be tricky in terms of dialing up the right dosage. Or in one case, we had someone that mixed it up with their insulin pen because they were taking it for diabetes, and they accidentally dialed up 30 clicks thinking it was 30 units of insulin instead of one click like they intended. And we have had accidental injections into fingers as well. And then in one case, a provider prescribed 20 units instead of 2 units. So a tenfold error is fairly easy. It's a simple error that can make a big problem if that happens. So, of course, if you're taking a medication like this and ever have an issue or a question, please give us a call at the Poison Center. We can evaluate the situation and the risks and determine if it's something we can watch at home or if it's something that would need to go to the hospital. So as far as these products go, we do have a lot of cases of pharmaceutical companies running out of it. For that reason, there are some compounding pharmacies and other suppliers that will try to fill this void to have the medication available. And of course, they want to make a profit. The downside of these compounded medications is that sometimes they are incorrect doses. They may not be as reliable as something from a regular pharmacy. And sometimes they have undeclared ingredients, like they may add vitamin B12 or other things in it when they're compounding it. So always be very cautious and use a reputable healthcare provider when you're getting these medications.
Awesome. Right. Well, thank you, Abby, very much. We're going to talk through a bit more on the prevention side. Really, before use of any medications, it's best to involve your healthcare provider before you start any medication regimen or diet or exercise program. And as Abby said, we've had some exposures involving kids. So like any medicine, it should be kept out of sight and reach of children. And these medicines often have different schedules than we're used to, like a once a week schedule versus a daily schedule. So pay close attention to the timing and proper dosing. Lots of people think more is better for medication, and that is not true with these. We can have more side effects, more uncomfortable side effects. So don't take more than prescribed. And they do come in injectable pens, and that requires a little bit of training, right? And so it is important to learn that either through your healthcare provider, through the pharmacy, or a qualified healthcare provider. So make sure you know how that pen works properly. You can dose it up and down properly, and you practice with it so you have some ability to use it properly. Make sure your healthcare provider knows all of your medications and supplements. That goes with all medications. And as Abby mentioned, you don't want to buy it from a reputable pharmacy or online distributor that your healthcare provider recommends. There also is sometimes these are drawn up in a syringe versus having a pen. And there are different types of syringes that have different volumes or amounts that they contain. And so they're not all the same. So what looks like a dose on one syringe may be a different dose on another syringe, depending on its size. So make sure you're using the same type of syringe you were provided or trained with, and ask your healthcare provider if you need additional. And then it is not recommended to take these medications during pregnancy or planning for pregnancy. Do you have any other tips, Abby, for us before we close out?
No, I think that pretty much covers it. So hopefully this will help keep everybody a little bit safer. But yeah.
Yeah, and if something does happen, feel free to call and speak to one of our registered nurses or pharmacists. We're here 24 hours, 7 days a week. Here is the phone number, 1-800-222-1222. Save it in your phone and have it ready. We're here every day of the year. So even Thanksgiving, if you have questions this year or the upcoming holidays, please reach out. We're happy to help. Have a great day.
Yeah, thanks. Happy holidays, everybody.